Hi, it's Kylie with Punks for Progress. I recently worked as a nurse at a Catholic hospital, and going into the job, I didn't think it'd be any different than working at other hospitals. Most hospitals have a chapel and clergy and spiritual care services to offer to patients, and I figured it'd be just very similar to that, maybe hyped up a little. What I did learn and observe and hear from other staff members and learn through my research is that the care you receive at a Catholic hospital is going to be substandard to what scientific standards are. The care you receive at a Catholic hospital is going to be in compliance with the Catholic Church's teachings, which may not be in your health's best interest. So today I want to talk about the prevalence of Catholic hospitals in the United States and the ways in which your care is going to be different at a Catholic hospital than at a secular one. So if you go to a Catholic hospital emergency room and you're bleeding profusely and the treatment to stop the bleeding is not in compliance with the Catholic Church's teachings, you will be sent home. That hospital is not required to tell you about the other alternatives that are available and made possible by modern science. They are not required to give you a ride to another hospital for alternative treatments. Again, they will just tell you to go home and that there's nothing they can do about this crazy bleeding that you're experiencing. Now, when I first heard about this, I just figured that Catholic hospitals must be private institutions, and that's how they get away with this. They must not receive government funding, which is how they can, treat patients this way. That is not the case. Catholic hospitals are widely nonprofits and receive government funding. They receive government tax breaks for being nonprofits, and they contract with the government programs of Medicare and Medicaid. And yet they can still treat people differently based on their religious beliefs. Now, in the months that I've known about this and tried to figure out how they get away with this, I have yet to find an answer. According to internet bloggers, apparently the ACLU is working hard to fight the Catholic Church on a lot of these instances where care is substandard. But the biggest issue is that nobody wants to combat the Catholic Church. And so the Catholic Church gets away with this. Now, I believe this is completely unacceptable, yet they get away with it. However, if this was a different religion imposing their beliefs on the American healthcare system, I believe that it wouldn't be tolerated. For example, Jehovah's Witnesses, they believe that they should not receive blood products or blood transfusions, even if it means that they're going to die. So let's imagine that Jehovah's Witnesses owned and operated as many hospitals as the Catholic Church does in the United States, and you needed a blood transfusion, but you were at that hospital. They wouldn't have to tell you that blood transfusions exist. They wouldn't have to tell you that you could go to another hospital and receive a blood transfusion. They would just simply let you die because that is in compliance with their religious beliefs. So let's talk about prevalence. Here's some statistics from a 2016 report by Merger Watch. It's an organization and a website that you can go to for the latest healthcare news about mergers and buyouts in the industry, which is super helpful. And you should really pay attention to what's going on in your community with who's owning and buying out which hospitals and clinics. So let's read the statistics. As of 2016, 14.5% of all acute care hospitals in the United States are Catholic-owned or affiliated. Over the 15-year period, 2001 to 2016, the number of acute care hospitals that are Catholic-owned or affiliated grew by 22%, while the overall number of acute care hospitals dropped by 6%. 1 in every 6 acute care hospital beds is in a facility that is Catholic-owned or affiliated. There are 5 states, Alaska, Iowa, Washington, Wisconsin, and South Dakota, where more than 40% of acute care beds are in hospitals operating under Catholic health restrictions. In another 5 states, Nebraska, Colorado, Missouri, Oregon, and Kentucky, between 30 and 39% of the acute care beds are in facilities that are Catholic-owned or affiliated. There are 46 Catholic restricted hospitals that are the sole community providers of short-term acute hospital care for people living in their geographical regions. The largest Catholic health systems in the nation now control 384 hospitals, compared to 330 in 2011 and 259 in 2001. So why is this a big deal? So in an emergency and you call the ambulance to take you to the hospital, they take you to the nearest hospital for you to get care. Now, for most of America, there's a 1 in 6 chance you're going to end up at a Catholic hospital. For those 10 states that we previously listed, there's a 30 to 40% chance you're going to end up at a Catholic hospital. And for some places in America, there's a 100% chance you're going to end up at a Catholic hospital. So let's get into areas of health and the ways in which you will receive substandard care at a Catholic hospital or at a clinic that's owned by a Catholic healthcare system, the doctors that have to answer to that Catholic leadership. First and foremost, sex and baby making. We know that's a big deal with the Catholic Church. So according to the ERDs, or the ethical and religious directives that are handed down from the Pope in the Vatican, this is called the Marriage Act, by which human life is transmitted. Sex. So no condom distribution, birth control, or sex education besides abstinence. This is likely common knowledge to everyone, but think about how that can affect you and me. If I'm admitted to a Catholic hospital because it's the nearest hospital and I have a raging fever and I'm sweating, and I need IV antibiotics for a kidney infection, the doctors there are not allowed to prescribe me my home medication, which is birth control, because it's against the Catholic Church. Even if I'm not taking the birth control to prevent pregnancy, but rather to regulate heavy periods, or even to prevent cysts in my ovaries from bursting, birth control can be used for that too. I will not receive it while I am inpatient at a Catholic hospital. Also, a doctor working for a Catholic healthcare system cannot assist, advise, or aid in any birth control methods that have been prescribed elsewhere, but now the patient is experiencing complications. There are many examples of women sharing their experiences of this on the internet and news stories, and the ACLU is representing them. For example, IUDs that are misplaced or cause horrible bleeding, and this woman presents to a Catholic facility. They won't touch it. They won't assist in any way, shape, or form of aiding with birth control. Next, no sterilization, no tubal ligations, no vasectomies, neither temporary or permanent. Now, a real-life example. I have a friend whose closest hospital to her was a Catholic hospital. She had a high-risk pregnancy and had to have a C-section. Now, it is common for women to have tubal ligations after a cesarean because the body's already open, you already have the sterile environment, you already have the doctors and the support there, and you have access to the organs to do that tubal ligation. And so the friend of mine had a high-risk pregnancy, knew that after she delivered this baby, even if it was successful, did not want to get pregnant again because of how high risk it was. Therefore, she wanted to have a tubal ligation when she had her cesarean. Because she delivered at a Catholic hospital, they would not tie her tubes or her fallopian tubes while she was open and delivering her baby. She was sewn back together and had to reconsult, reschedule, and be readmitted for that procedure at a different hospital, which just increases infection risks, and is just really difficult for a woman to have to go through that process when an alternative exists. So still on the subject of baby making, or the Marriage Act by which human life is transmitted, Catholic hospitals and doctors and clinics within Catholic healthcare systems cannot assist with artificial reproductive technologies, including in vitro fertilization, donor sperm, eggs, surrogates, no fetal screenings for fatal abnormalities, and no stem cell research. Which all of those are becoming very common for women who have issues getting pregnant and want to become pregnant. Next, let's talk about abortions. It's well known, everybody knows the Catholic Church does not approve of abortions, but did you know to what extent? And did you know that the lack of care that women receive at local Catholic facilities because of this belief? The Catholic Church's definition of abortion is much more broad than even the conservative states that have now passed abortion laws this year. According to the Catholic Church, they will not abort an ectopic pregnancy. They will not abort any kind of fetus with a fatal anomaly. They will just say that it's a fight for your life and it's kind of either you or the baby's going to survive, but both lives are equally important to them. So just go home and bleed it out and see what happens is what they tell women, which is really gross. Lastly, I want to talk about end-of-life care at Catholic hospitals. Catholic hospitals will not honor advance directives that are not in compliance with Catholic teachings. Now, an advance directive, if you don't know, is something that you state, fill out, a form, sign, date, expressing your wishes regarding how you want to be treated towards the end of your life, whether you experience an unexpected trauma or the progression of a fatal illness. It states your wishes regarding breathing tubes, feeding tubes, CPR, whether you want those attempts made to resuscitate your life or prolong your life. So the most extreme example of this would be death with dignity or assisted suicide is what is most commonly called. There are a few states that have legalized this, and in those states there are Catholic institutions that receive public money that are refusing to participate in the practice. So it'll be interesting to see how that pans out. The more subtle examples I can think of are your wishes to be for your attempted resuscitation using CPR, using a breathing tube, and receiving nutrition through a feeding tube. Some people, especially at the end of their lives, have very strong feelings about each of those interventions. And unfortunately, a Catholic hospital will not honor those if it's not in compliance with the Catholic Church's belief that in human dignity and in the sanctity of life. Also, let's talk about organ donation. So if you are an organ donor, there's a possibility that the Catholic hospital in which you die at or are transported to after your trauma will not honor your wishes to be an organ donor. And it actually gets really complicated understanding why the Catholic Church won't do that in some instances, and I'm actually going to make a separate video if you want to get into the nitty-gritty about the definition of death and organ procurement, but I just want you to be aware that the Catholic hospital does withhold and doesn't honor some advance directives as it relates to that. So I want to urge you to pay attention to your community, pay attention to Merger Watch, pay attention to buyouts with huge healthcare systems. There's a phenomenon called ghost Catholic hospitals, I think it is, where the outside doesn't even appear like a Catholic hospital. It's not called St. Mary's or St. Dominic's. It doesn't have a cross on it. It could just be named Podunk Town Community Center. But because of financial issues, it was bought out by a Catholic healthcare system, and it is now forced to comply with Catholic teachings. So be aware, ask questions. Unfortunately, I believe Washington is the only state that has made it mandatory for hospitals to put on their websites what they will and will not do. So it's unfortunately not available to you. So make sure you're talking to your doctors about what limitations they may have based on their leadership, management, and owners of their clinics and hospitals. Lastly, I just want you to know that employees of the Catholic healthcare system may not necessarily will be Catholic or believe in Catholic principles. So don't blame the employees. It is the stupid business owners and the leadership of the Catholic Church that is forcing these facilities to operate this way so that they can receive the funding and support of the Catholic Church. All right, well, thanks for watching, and stay tuned for more videos from me about the healthcare system, and I'll see you shortly.